Thank you very much for the opportunity to present in this important webinar. My name is Dr. Eugene Tuyishime. I'm an anesthesiologist, a faculty at the University of Rwanda. I'm also the CEO of the Initiative for Medical Equity and Global Health. I'm happy to be here, and I wish everyone a happy World Anesthesia Day. And this is a good timing because the theme of this year is workforce well-being. So the title of our discussion today is around the clinician wellness during the time of Marburg outbreak in Rwanda. And this has three parts. So for the first part, I will do a short review about burnout and wellness. And then all my colleagues will be involved in the discussion, including Dr. Jackson Quizera, Dr. Gaston Nyirigira, and Prof. Pauline Banguti, and then we'll have everyone to be involved. Feel free to ask questions and to put comment in the chat as well. So at the end, we'll show you some of the key actions you can take to improve your wellness. So the objective of this short presentation are to highlight the factors leading to burnout and distress during crisis, and to discuss effective interventions in reducing perioperative healthcare providers' burnout and distress, especially during the crisis. So let's start with a quick definition. What is burnout? So when you have emotional exhaustion and depersonalization or cynicism, you are at high risk of burnout. So on top of that, if you have a low sense of personal accomplishment, then you have burnout. What about wellness? So wellness is defined as a good quality of life, which may include absence of being ill, a presence of positive physical, mental, social, and integrated well-being, where a physician will experience good activities and within the environment, allowing them to achieve their full potential, both at a personal level and work-life domains. Now that we have a brief overview about the definition, let's talk about the drivers and the consequences of burnout. So on the left, there are many drivers that we have to improve in order to ensure that we have good wellness. If we don't address these drivers, then we have high risk of burnout. This may include workload and job demand, control and flexibility on our schedule and the workplace, work-life integration, social support in the community at work, organizational culture and values, efficiency and the resources, especially like equipment and like monitoring we use, medications, and also the way we work as a team, and then meaning in work. So if we don't address these drivers, then we have high risk of burnout with consequences both at personal level, but also at professional level. So at personal level, you have risk of broken relationships, alcohol and substance use, and depression, and sometimes suicide. And at the professional level, you have decreased quality of care, increased medical errors, decreased patient satisfaction, decreased productivity and professional effort, and high physician turnover, which may be challenging when you don't even have enough healthcare providers. What about the risk of burnout and also other mental problems during the crisis? So I have shared a few articles here to show that what we learned during COVID is that healthcare providers were at high risk of burnout, where the risk was increased by more than 3 times, both for burnout but also depression. At the same time, there was challenging times leading to risk of suicide, and at the same time, people were more afraid about losing their job, catching the virus, balancing both life and work. So many challenges really impacting the wellness, including fatigue as well, and medical errors. So we have done some studies in our context where we have found that 26% of anesthesia providers in Rwanda have high risk of burnout, and also 44% have emotional exhaustion, which is concerning. So we have also done a qualitative study which was currently published in British Journal of Anesthesia, showing the lived experience of people working in rural resource settings across Rwanda. So we have found that people have the most causes of stress at work include high workload, not having adequate resources, um, and also insufficient remuneration and seeing poor outcomes. And this leads to some consequences like severe fatigue and physical exhaustion, feeling like hopelessness. Um, and in the context of our culture where people are not supposed to talk about it, suppressing emotions, and sometimes this may lead even to lack of empathy to our patients. We have also asked our colleagues in another qualitative study about how can we manage this situation? What are the potential solutions? They have suggested some of their approach, including having good coping mechanism, where they spend good time with family and colleagues, uh, taking some rest when needed, listening to music, going to church for praying, having enough sleep, and doing some exercise. Also, they suggested that they think psychological support should be available. I don't know if this is available to everyone because it is associated with stigma as well. So peer support, where people get a chance to talk about the situation and share their how they feel, and also resilience training. I don't know how easy and accessible this type of training are. And now, but we'll share some resources of accessible online training for resilience. Another important aspect of potential solution is to increase awareness and to do advocacy both at the level of the individuals, but also at the level of the administration. I highlighted things that I thought that as individuals we have the capacity to do, and other areas may need more advocacy and involvement of administration, and we'll discuss that another time. Some effort have been done in our context, and my colleague, Dr. Gaston Nyirigira, was involved in implementing the vast awareness course, which has shown to increase awareness, reduce stigma around mental health and burnout and awareness, and also to provide people with the skills for better self-care. So now that we have discussed about burnout and wellness and potential solutions, you may ask yourself, what can I do now, especially during this crisis? So I think being involved in small group discussions with colleagues to discuss about your feeling, that will be essential, and it has been shown to be effective. But also to have regular peer support programs where senior people may support junior people, but also among peers. I will share also at the end of this webinar the Resilience and Well-Being course by the American Medical Association, which I think is a good guide for self-care. And also, we have developed an application you can use for wellness monitoring. And when you answer at least 4 times with yes, then you may be at high risk of severe distress and mental issues, including depression and risk of suicide. Then you may have to seek professional help. Otherwise, if you answer less than 4 yes questions to the questionnaire, which will take less than 2 minutes, then you know that you're in a good state, but it's a good way to monitor your wellness. So I will not go in details about the long-term solutions because we're in a time of crisis. I will just give a final thought about recommendations, and then we'll follow up with a discussion from my colleagues and also to get question and answers from all the participants. So my key recommendation at this time, I think it's important first to develop individual wellness strategy so that we ensure better self-care, especially during the crisis where we're supposed to keep providing services. Second, I think we have to organize and participate in peer support programs, and this may have different forms. One way is to have regular debriefing about the situation and also to have check-in every 2 weeks or every month to know how people feel. And also, if people are struggling, then we may guide them towards professional help. Lastly, I think we should do more advocacy to make sure that our administration, both at the level of the department, but also to the hospital, they prioritize wellness as a priority so that we can keep providing the high care possible while taking care of ourselves. Thank you very much for your kind attention, and we'll follow up with the discussion with my colleagues. And again, feel free to ask any question and put your question in the chat. Thank you.